But it's a journey we have walked together. This House has been the bedrock of that transformation. Without your legislative wisdom, your oversight, and your bipartisan support, the milestone we celebrate today could remain mere aspiration. And for that, Honorable Speaker, I want to say asanteni sana, and we are happy that you stood with us. Honorable members, our mandate basically is anchored in the better agenda, the bottom-up economic transformation. When this administration took office, we made a very solemn vow that healthcare will no longer be a privilege for the few who can afford it, but a constitutional right for every Kenyan, as it is enshrined in Article 43. Health is not just a social service, it is a key economic pillar. And I say that with conviction that a healthy nation is a productive nation. We committed to shifting the paradigm shift from curative to preventive care and from catastrophic out-of-pocket expenditure to social insurance model that leaves no one behind. To realize this, Honorable Speaker, this House undertook a historic legislative marathon. You debated, you refined, and you enacted 4 crucial laws that now form the legal spine of our healthcare system. And that is the Social Health Insurance Act of 2023 that established SHA and replaced NHIF, the Digital Health Act of 2023 that created the Digital Super Highway for Health Data, and the Primary Health Care Act of 2023 that operationalized the hub and the spoke model and the community health promoters. And finally, more importantly, the Facility Improvement Financing Act of 2023 that ensured funds raised in hospitals stay in hospitals. Honorable Speaker, let us be very honest about where we came from. Prior to these reforms of this administration, our systems was ailing. We had a very fragmented financing model where NHIF paid out more in fraudulent claims than it collected in legitimate premiums. We had no visibility of the patient data. We had no visibility of the patient records, and patient records were paper-based. Making portability was impossible. When I first stood before the ministry during my maiden speech on 1st of April 2025, the situation was critical. We were 6 months into the Taifa Care rollout, facing public scrutiny and a systemic roadblock. I told the country then that, and I was given a name that I am a bulldozer, and that was for the right reason, to clear the way for universal health coverage, but to crush the bureaucracy and to build a system that works. Today, I return to report to the people's representative how that ground has been cleared, what we are building upon it. And I want to start with the first pillar, the pillar of sustainable health financing. I wish to begin with that pillar, and the transition from NHIF to Social Health Authority is the engine of our reform as an administration and a country. The numbers tell a story of unprecedented success and stability. As of 26 January 2026, we have registered 29 million Kenyans into the Social Health Authority. This mass registration has translated into tangible financial health for our system. We have collected 130.4 billion in contribution. And critically, we have disbursed over 93.4 billion to healthcare providers, both in public, in private, in faith-based, and in our national referral hospitals. Contrary to the inefficiency of the past, we are making great strides in settling all verified, validated claims. Currently, we have achieved an average claim settlement rate of 73% across the board. This means that money is flowing to our hospitals, ensuring that facilities remain stocked and operational. Honorable Speaker, as I say that, I want members to be cognizant of the Schedule 4 of the Constitution, that health is a shared responsibility, that health is a devolved function. A key component of this financing model was the realization through this House of the free primary health care, which has never happened in our country before. We are currently rolling out service charter to primary health care facilities across all the 47 counties. And we are doing this from last week because Kenyans go to primary health care facilities, level 2 and level 3, that's the dispensary and the health center, but they are forced to co-pay. It's supposed to be walk in and walk out. So we have created now a charter, a green label charter, which we are going to fix, and we have started with the Bomet last week. We'll fix it in every level 2 and level 3 public, private, and faith-based health facilities. This charter, and I want to highlight that Bomet Health Center, which has the distinction of being the first facility to successfully roll out this charter. This charter is our promise to the people that at level 2 and 3 facilities, a Kenyan citizen should be able to walk in and walk out as an outpatient without paying a single shilling. We have already seen 800 million Kenyans have accessed services at the Primary Health Care Fund, proving that when financial barriers are removed, our people will seek care early, preventing complications and saving lives. To ensure that this safety net covers everyone, including Mama Mboga and Boda riders, Honorable Speaker, in June of 2025, during Madaraka Day in Homa Bay, President Ruto launched the Lipa Sha Pole Pole initiative. We understood that the informality of our economy requires flexibility. This innovative payment model allows Kenyans in the informal sector to make a small, manageable contribution towards their health cover rather than a lump sum. This has democratized access to insurance, ensuring that economic status is no longer a barrier to quality health care. We are currently having over 410,011 active payers utilizing this Sha Lipa Pole Pole. And so far they have contributed over 1.4 billion, a clear indication that Kenyans are willing to pay for their health when given a dignified option. We are also committed, Honorable Speaker and members, to ensuring that the most vulnerable among us are not left behind. The national government is currently sponsoring over 558,000 indigent households, picked from the social health protection data in all our villages and all our counties and constituencies. And those 558,000 indigent households are having the Social Health Insurance Fund premium cover. I must also commend a number of counties, and one of the most best counties, Muranga County, which has set a gold standard by fully meeting its statutory obligation and sponsoring over 38,000 indigent households and remitting their full annual premium of the SHIF. And we asked more other counties, Makueni County, Kisumu County, most of our other counties are also preparing their list between 10,000 to 20,000 indigents so that they can pay for. Honorable Speaker, furthermore, through the through the national government CDF, a number of members of parliament have paid for indigents from their constituencies. And you can see the list here. And there are more that we are going to post. And I have asked the CEO, Honorable Deputy Speaker, representing a number of our women rep, has also submitted the list. And I've asked the CEO of SHA to make a dedicated desk and staff to attend to members of parliament, starting tomorrow once this workshop is finished, so that the figure is known, the figure has been agreed, and is a flat figure, and we want in your constituencies to give us the list. If you tell us to pick it from the database, we will pick it from the database, social protection, but we want our members of parliament, and they have been doing it even before. But right now, because members are asking me, how do we do it? I have directed SHA, now that they have a skeleton staff, to dedicate a specific desk that, and even come to parliament. The clerk of the National Assembly, through the speaker, can even give us a room within parliament where the SHA members can be accessed by members of parliament. Members of parliament do not, even your offices, your staff can access our team in parliament, but we really want. We have collectively together, we are sponsoring partners and development and philanthropies are sponsoring close to 62,000 if I add with the ones of members of parliament. But I want to urge the honorable members to utilize the national government CDF to sponsor the indigent in your constituencies so that we mirror this success to ensure the universal coverage. Honorable members, for a long time, the overseas treatment scheme was a conduit for abuse between doctors in Kenya and hospitals in India and many other places, where cartels and these agents exploited the vulnerable patients and the public purse. That era is over under SHA. We have introduced a robust, transparent framework for overseas referrals that put the patient first and protect our resources. This new policy, Honorable Speaker, is anchored on a simple principle. SHA will only pay for overseas treatment if that procedure is not available locally. Because when you go to India, you are supposed to go with the whole family. It's more expensive for the family, and that is why we have to do a lot of harambe. And to enforce that procedure, I have appointed the Benefits Package and Tariffs Advisory Panel, a team of top experts who have vigorously assessed our local capacity. And I am pleased to report that the panel has successfully identified and listed only 36 medical interventions that are currently not available in Kenya. And these are the only conditions for which SHA will authorize treatment abroad. If you want to pay for yourself, it's okay. But under SHA, it must fall within the 36. The only conditions which the law allowed us. We have also introduced a very strict vetting protocols. Every referral is now subjected to a peer review by the claims office to ensure that the medical necessity is found. Honorable Speaker, we are also requiring that any overseas facility receiving a Kenyan patient must also formally empaneled and contracted by SHA. So you cannot go to India and walk to any hospital. The way we contract Aga Khan and Kenyatta Hospital, the facilities in the foreign nations must come and contract with SHA. And we do it online. Honorable Speaker, we have capped the minimum payable amount for this overseas treatment to 500,000. This will ensure the sustainability while granting access to life-saving procedures. This new framework guarantees that we are not going to exporting our patients and also exporting our money to support healthcare system of other nations. And let me repeat it. We will not export our patients and our money to support healthcare systems in other countries. We must be candid. We must improve our healthcare system so that the money can remain here and support our health facilities. Our patients can be at home, and many members know during the COVID, we could not even return the bodies of our loved ones when they pass in India. Because in some countries, the only thing that happens is cremation. Many Kenyans, particularly of the Christian faith during COVID, they could not bring back their bodies. Airlines have refused. Countries have introduced protocols. So we must build Kenya. We must retain our patients here, treat them, and we must retain our money. Honorable Speaker and members, the transition from NHIF to SHA is not merely a change of logo. It's a fundamental restructuring of our national health insurer to ensure efficiency, integrity, and professionalism. We are building a new institution from the ground, and this requires a fresh, competent workforce. And I wish to be categorical. Recruitment into SHA is strictly based on merit, unlike the NHIF, unlike the defunct NHIF. There is no automatic transition. However, Honorable Speaker, we were guided by the courts. The former staff of NHIF went to court, and we were guided by the law and the courts that we must give priority to competent, qualified former NHIF staff. The days of nepotism and incompetency are behind us. Only those who prove their worth will serve the people of Kenya. And Honorable Speaker, to make the record straight, to date we have only recruited 144 staff members, representing 17% of the total approved establishment of 815 positions. The initial phase focused on securing the top leadership and the core leadership and the technical experts needed to operationalize the authority, including the CEO and the directors. We are now doing a massive recruitment drive for 425 senior officers in order to decentralize them to our counties. And this exercise has been highly competitive. We have received 17,434 applications, and we are following vigorous shortlisting process. We have shortlisted 1,737. And Honorable Speaker, I want to categorically say the list that is circulating in the social media is a fake list, is not from SHA. And I am ready to present the truth. Yeah, there are people who doctored that list in terms of counties, in terms of tribes, for their own reasons. I have a full report before Parliament, and I'm ready to submit that. That list is fake. That list is meant the people who could not say anything about SHA. They have looked for anything under the sun, and they have generated a fake list. And I am ready to appear before the committee of even cohesion and integration. I think that committee still exists in the House. Yeah, I'm ready to appear before that committee and put everything on the table. But that thing which is going around is not from us. Honorable Speaker, let me go to the pillar number 2, comprehensive healthcare information digital superhighway. This superhighway has been the game changer in our history, where for the first time, visibility of our healthcare sector, all our 47 governors, the whole leadership of MOH, the president himself has a digital dashboard that he can follow what is going on in the health sector. And Honorable Speaker, if you allow us, we can give Parliament also a dashboard that can be put somewhere. You can see even the bed occupancy of Kenyatta Hospital. We have successfully, up to today, digitized and linked 10,277 transacting faith-based and private hospitals into one digital superhighway. We have specifically have 4,149 public facilities that are now fully digitized, because slowly we are training and we are digitizing